Hello and welcome to Kids OK Please Live. I am so glad to be back again, and I'm very grateful to our founder, our co-founder, Ritesh Bafna, my dear colleague, to have filled in for me while I was attending to an emergency in the family. And it's such a pleasure to be back again. Hello Sheena, hi Pradnya, hi Shiba. Hello. We today have a very interesting guest. She's a pediatric dental surgeon, a master's degree holder, a very profiled dentist based out of South Bombay joining us. And we're looking forward to unravel insights and knowledge about children dental health. So I'm gonna invite Sheena now to join us. Hi Sheena, hi. Let's Sheena. We're waiting for Sheena to join us now. Hi Sheena. Hi. How are you?
I'm good. How are you? How's it going?
It's going very well. It's such a pleasure to have you with us.
Same here. I'm glad to be here too.
Yes, absolutely. So how's it there? How's the weather there? How are you feeling today?
Oh, great. A busy day. Started off well. Hoping it goes on well. How are you?
Fantastic. I am excellent. I'm at my parents, and it
Okay.
is it's such a pleasure to be here after a long time, and feels very good indeed. Feels very good. Feels very good to be a slight of a child yourself, because no matter the age you are, your parents tend to spoil you, especially when you come home after a long time. So
Definitely.
yeah.
I can feel you for that.
Yes, indeed. So Sheena, so guys, Sheena is a very profiled pediatric dentist, and she's gonna tell us about children's dental health today, and we're gonna unravel insights about children's dental health. And hello, Shagun, hi. And we're gonna let us start. Sheena. So to begin with, I'd like to ask you. There's always been when we look at children and their teeth. Of course, their teeth fall off, and then after a certain age, the process starts where they get their permanent teeth. So there is always hello Akash. And there's always a discussion about how many times. There's a lot of discussions about children and how should they, manage their teeth or their dental health. So it is so great to have you here and to finally listen to it from the expert about
Something biggest myth that they have, the parents actually have, that my
as well.
child's teeth is going to fall anyway, so why should I take care? Why should I go to a dentist? So that's the biggest
Correct.
myth. And I'm going to tell you that
Right.
it's not true. You have to visit a dentist as early as possible at the
Correct.
age of 6 months. That's
Wow.
the first time you should visit a pediatric dentist or a regular dentist of yours. So that's 6 months is the age when your first tooth erupts. So it's very important you make an effort to visit a dentist. So the first visit is basically just so that the child gets acclimatized to the area. He knows that I need to take care of my teeth in the future. The parents know that they need to take care of their kids' teeth in the future. So that is why the first visit is important. And well, there are so many other things that the parents keep asking. We'll keep discussing as we go ahead in our session.
Of
And
course. Of
yeah,
course. So let us start with the very first thing. How many times should children ideally brush their teeth?
ideally, children and adults should brush twice a day in the
Twice or
morning,
thrice? Twice.
twice a day, twice a
Twice.
day.
Mm-hmm.
Yes, times a day, morning and evening. Uh, morning and evening before sleeping. So it's very important that they brush. Now, kids above 4 should start flossing as well. Okay, it
Oh,
should be in their habits. Parents should help them to floss their teeth. So by the age of 8, they will learn how to floss their teeth. Okay,
correct.
and there is a technique that kids should follow for
Oh,
brushing. It's called a circular motion. So we usually advise the parent to hold a finger like this and tell the child to go round and round and round. Okay, in this way they learn this motion and they can brush their teeth. So till
mm-hmm,
the age of 3 years, I would advise all the parents to brush their child's teeth, make brushing
mm-hmm.
fun for them, play their favorite music, or play a song in the background for 2 minutes and fun, brush along with them. So this way the child also gets used to brushing.
So
And
that's very. If I may intervene you for a second, playing a song, especially a trend that we've been noticing in children. If I'm sure if our children audiences are listening to us, they'll relate to it. Is that music is and dance is seeped into very well into the younger audience,
yes,
younger. Yeah, and they love to dance to tunes and they love to jam with them. They love to sing along. So I would like to tell all of our parents this, that please make a note of what Sheena's saying. If your children do not trouble you while brushing their teeth or lazy, a very good way to get them to do that uh, uh, is to play their favorite song and dance with them, groove with them, sing with them,
yes,
and
definitely. Really
that
helps.
that really helps. A wonderful comment here by Amit. He says, I have a song with my son for hand wash and brushing. So
Oh,
yeah,
that's
yeah,
great.
Hannah.
Somebody has started. That's
Yeah,
amazing.
yeah. That's amazing. That's amazing. So, all right. So that is about brushing, the correct technique. And now coming to toothpaste, is there when it comes to children's teeth, which is there a particular type of toothpaste that you would recommend, or uh, how would you suggest that? Is there a particular brand? Is
So,
there a particular type that you would
yeah.
ideally suggest for children?
So for kids, I would recommend that once they turn 6 months of age, they start using a fluoride toothpaste. Okay.
Okay,
Now there are various toothpastes available. There is Cheerios, there's Chiku, there's Pigeon, Colgate, Pepsodent, and numerous numbers. So any
correct.
toothpaste that contains fluoride is going to be good for them. Okay, and so now initially we have seen that kids who brush with Colgate and Pepsodent, like the adults brush with close-up Colgate and Pepsodent, they find it very spicy and minty, so they refuse to brush. Now you get these various flavored ones that is available in the market for kids, strawberry and different flavors, so you can start off with that till they get used to brushing, the flavor of brushing,
Mhm.
and then you can switch on to the adult one. That is very important. Otherwise,
So
your
what is the
child is.
age? I'm sorry, what age do you switch to the adult toothpaste, and what age do you
Uh,
start
See,
with?
you can brush till the age of 5 till your child is comfortable, and then you can switch to the adult one. There's no specific age, but it's on the parent, especially on the parent. They have to get their child used to it. And also now a lot of parents are using these Ayurvedic toothpaste that are available in the market, which is Patanjali and Dabur and all of that. Well, those are also good, but I would recommend if you're doing one time in the morning and one time in the evening, switch on to a fluoride one in the morning and then use your regular Patanjali or Dabur or whichever you feel the brand is you are comfortable with. So in that way, you're giving fluoride to your child as well, which is very important.
Hmm. And why don't you elaborate on fluoride and its importance? Why don't you
Yeah.
tell our parents and children about that?
Yes. So, fluoride is very important for your teeth. Okay, it makes your teeth. I'm gonna say it in a very simple word so that all the
See,
parents out there can understand what is fluoride and why dentists emphasize on a fluoride treatment for your child. So, fluoride is it's a mineral that makes your teeth much stronger and it helps to fight cavities. Okay, so now it is fluoride is available in different forms. It comes in your tap water, it in school water. There are fluoride tablets. There are fluoride in your food. So there are various means where you can get fluoride. But what has happened is now parents have switched to boiling water and very restricted food. Less salt and everything. So they are total intake of fluoride has actually gone down. That is what we've seen the trend here. So it's best that you take an advice of your dentist and start with a fluoride treatment. Now, fluoride treatment is mostly recommended in kids who are at a high risk to cavities. Whose parents have a lot of cavities or whose child are is you see kids, 2 year old kids who have massive caries in their mouth, and the parents don't know what happened and how can we take care of it. So that way, fluoride is very important. It forms a strong layer on your outer covering of the tooth that we call as the enamel, and it
correct.
helps to fight the cavity. So we recommend a fluoride varnish or a gel for kids every 6 months or yearly, depending on how prone to caries you are. And we have something called as sealants, that is the fluoride sealants that we do for kids, where we seal off your molar teeth, which are more prone to caries, with the help of fluoride. So what it does is that it will keep releasing fluoride in your mouth for every time, and in this way, your mouth will be little alkaline and not too acidic when you're eating food. So that way, it is very important that your toothpaste includes fluoride, your food includes fluoride, your water includes a little fluoride. If nothing, you come to us, we will make sure that your teeth includes fluoride.
Of
So
course.
that's about fluoride. And
Lovely.
yeah, so
Lovely. Lovely. Very insightful, Sheena. Thank you. Now, coming to food. Well, let's start with chocolates because a lot of parents would like to think that if children are going to eat a lot of chocolates, who would, Because
yes,
essentially now
definitely.
that, yeah, but then again, chocolate and cavities is something
Yes,
that's an age-old dispute
yes,
between children and
definitely.
parents. Mama give me chocolates, Dada give me chocolates, but you can't have chocolates. So why don't you unravel that mystery for us? So
So now,
what is, yeah,
so
you
it's
feel
very
me, right?
difficult. Yes, so it's very difficult to say no for chocolates to kids. As a dentist,
Yes.
also, I cannot tell the parent, just tell them stop chocolates. It's very difficult. So what you can do is you can start giving chocolates to them in your at lunchtime, especially during your second meal. That's your lunch. So the saliva, that is your salivation, is maximum during that time. So whenever you're going to eat anything or a chocolate, it will help to remove it. Your saliva will help to remove that layer. So that is why it is recommended that if you are giving chocolates or anything sweet or any chips which has refined sugar or anything that is junk which contains sugar, try to give it during lunchtime
Yeah.
and not during dinner or post dinner. And try to minimize your sugar intake for your child, especially. You can have a deal with him. You can say that Sunday is a day for chocolates and binging and all the junk. So, and you can tell him that if you do this correctly at home, these are the few things that you have to do correctly, then maybe I'll give you something, a small treat. So that way you can help him to reduce his chocolate intake, which is very important. And also, now that we have seen that a lot of parents are giving, uh, you know, dry fruits as substitutes to chocolates, like dates and khajur and anjeer. So
Correct.
during their snack time, which I would like to tell them that it is not a good snack meal. It's good for the teeth, it's good for health, but it is not a good snack meal because it is very sticky and it sticks to your tooth and it can cause cavities later. So if you're giving dry fruits in the snacks, try to give it during your lunchtime, lunch meal or your dinner meal, but avoid during the snack time. That is like if you're giving a snack between your lunch and dinner after 2 hours, it is not going to be very helpful for your teeth. So
Perfect.
avoid that, and I'm surely you're gonna have great teeth then.
Indeed, indeed. So all
Yeah.
children, parents looking to have great teeth, please pay heed to that. Chocolate during lunchtime or dinner time, not during snack time. What about children binging, Sheena? Children having snacks, or is that how is that? Because children are very active and they spend a lot of energy and they feel very hungry. So is snacking between meals, is that good? Is that bad? What do you have to say about that?
I'm sorry, I'm unable to hear you. There's a lot of disturbance.
Oh, is it from my end? It's pretty silent here. So something to do with my network also seems pretty much fine. So can you hear me now?
Yeah, now I can hear you.
Lovely, lovely. So I was saying, what do you have to say about snacking between the meals? Because children tend to spend a lot of energy. They keep playing and they're very active, which is what makes them hungry and they want to eat. So what are you 2 cents on that? What do you have to say about that? Them snacking between meals.
So, as I mentioned earlier, try to reduce your snack time. Try, and even if you're snacking, give healthy snacks. Like cheese is very good for teeth, you know, but don't give bread. Give it with the nachni bread that is available now, your gluten-free bread, So, bread contains sucrose. Now, sucrose is biggest, what do you call, the criminal of our arch. That's what we call it in our terms. It's an arch criminal. So that's why we request parents to avoid snacking in between the meals. Give healthy snacks like fruits is very healthy, and fruits contains natural sugar, so that's very good. Give anything that's crunchy. You can give them nuts to eat. So this crunchiness helps to even activate your saliva and remove all the layer that is present on your tooth. I hope you can hear me because I'm getting a lot of disturbance.
Very well, very clearly.
So that is something that they need to look into. And even if you're giving them snacks, make sure they are gargling or they are cleaning their teeth or brushing their teeth after every meal that they are eating to avoid cavity formation. And in snacking, I would request all the parents to at least cut down on chips, which I have seen a lot during this pandemic. They have stacked up their kitchen with chips and cakes. Okay, give them something more healthier option. Now these nachni chips and all the other chips are available in the market. You get nachni cakes, you get very healthy cakes which are available. Try switching to that. It is very important for their kids' teeth. Otherwise, it'll be very difficult to maintain that oral hygiene for them, and you
Correct.
have to keep sipping in water. Sipping in water is very important after every meal because I have seen kids, they just eat and then they run and they forget to have water. So sipping in water is very important. Not any sugary juice or anything, but water, because again you're giving them sugar, which is going to stay in the mouth. So avoid sugary water or anything juice with sugar. Give them natural juice. Just give them plain water. That is very helpful. Also, one more thing that I would like to say is on the duration of your meal. That is also very important. So, when you're having your meal, like you're having your lunch or dinner or breakfast, try to limit your meal time to 15 to 20 minutes, not more than that. Okay. So, what
Wow.
happens is I get a lot of parents who tell me that We are brushing, we are not giving him chocolates, cakes, we're doing everything, doctor, at the best, but my child still has cavities. Now what do I do? So they forget to realize that it is something that when they're eating, kids are usually watching TV, or they're playing, or they're on their phone. So they tend to keep the food in their mouth for a long time, and their meal goes on to 30 minutes, 40 minutes, even up to an hour, which is very, very wrong. So parents should make sure that they finish their meal between 15 to 20 minutes. Okay, as if the food is in the mouth, the bacteria is going to start. So after 20 minutes, your bacteria starts attacking. Okay, attacking the food. Now the food is stuck on the tooth, so the bacteria will start attacking on the tooth, and a plaque is formed. Okay, now this will release that bacteria and cause cavity. So it's very important that parents restrict the meal time also to 15 to 20 minutes, maximum 30 minutes, because I know kids are very fussy while eating, but nothing more than that. And water is very important, to keep sipping in water after every meal that they have.
Lovely, Sheena. Very insightful again. Thank you. Now, coming to cavities, children and cavities again are something that occur in the same space a lot of times. So, what do you have to say about identifying cavity at home? Because let's say a parent is taking a child to you or their family dentist once in 6 months. Now, it could very well be that the cavity is growing before that, between those times. So, it's very essential for our parents and the children watching us to know how to identify cavity at home. Could you please elaborate?
Yes, that's an amazing question that you've asked. It's very important
Thank
during
you.
this time that parents identify the cavities at home now. Okay, now there are three parts of a cavity that the first one is where we can prevent it at home. That's called the white spot lesions. If you see your child's teeth, you might see few white spots in the front six teeth. Mainly, this is the most common place that you'll see these white lines or white spots on your child's teeth. Those are called as the white spot lesions that are present. Now that can be prevented by just doing basic fluoride treatment on the tooth, which I will also give you a fluoride toothpaste that you can use specially for such white spot lesions that you can use. And so this stage is a very preventable stage. If you have any doubt, you can always take a picture and send it to your doctor, and they will help you with that. And the second one is now the light brownish color that you see on your child's teeth. Okay, it's like very light brown, and you will see that there are pits also, light brown pits on the tooth. Now that is the stage, now the cavity has begun. This you cannot take care at home, you need to visit a doctor. And the third stage is a dark brown or the black color teeth. So that is a very, very, you're a high risk cavity patient, and you need to immediately ask your dentist or visit a dentist and start doing a treatment for your own child. So as I mentioned, now white spot lesions, that's the first preventable lesion that is at home, that you can take care at home. Is the if you see your child's teeth, you will see a white line, a white line around your tooth, especially the front two teeth. You'll see a white line like this. Okay, or on the third teeth, you will just see dispersed white spots on the teeth. Okay, now for that, there is something called as GC Tooth Mousse Plus, which is available in the market. It's best to call from Amazon. Okay, so that contains calcium, phosphorus, and fluoride. Okay, you have to apply it in the morning and evening, after brushing in the evening, like before sleeping. Just apply it and tell your child to go back to sleep. So you have to take it like pea size in your hand and just apply it and keep it. So what will happen is the GC tooth mousse is going to release calcium, phosphorus, and fluoride, and will form a protective layer on your child's tooth. Okay. Now these white spot lesions will not disappear or they will not reduce, but yes, it will form a layer. So at least your tooth is protected from further cavitation in the future. And now the second stage is your brown or your black. Now that you cannot treat at home. You need to visit a dentist for that. So it's very important that you recognize these three stages of your child, these three stages of your cavity in your child's teeth, and help your child protect and fight cavities. Okay, and now one more thing that I would like to highlight is the baby bottle tooth decay that we see in a lot of young kids, especially 2-year-olds, 3-year-olds. That is because of your feeding practices. Now, a lot of mothers, they feed their child night feeding. They're mostly all night feeders, okay? And then they go back to sleep. They forget to wipe the child's teeth. It is very important to wipe the child's teeth after every feed. What happens is the milk, it gets deposited in your the sulcus area
Vegetal.
that we,
Right.
yes. Right, yeah. And then the bacteria starts acting and then you have cavities. So it is most commonly seen in, that is what we call as nursing bottle caries. Okay. Most commonly seen in the front four teeth and the one behind. Like these five teeth, they are the most common sites for having this cavity. So mothers out there, reduce your night feeding after 6 months of age. You have to start weaning your child of breastfeeding or night feeding after 6 months of age. Okay, switch on to your normal cup or saucer or anything that is available. It's very important to limit, or even if you're feeding, limit your feeding practices and wipe your child's teeth with a muslin cloth or something to prevent further cavities in the future.
Fabulous, fabulous. How insightful. So I would now. What's really interesting is we generally have to wait for wait to come to the Q&A session until people start throwing in their questions, children and parents, of course. But since you've been live, questions have been raining in. So are you
Right.
ready to take on audience questions?
Yeah,
Yeah.
sure. I'm definitely.
All right, then let's look at the questions that we've got. Let's start with the first question. I believe is from Mommy Knows Everything. Mommy Knows Everything is says, when can you start brushing for babies?
Uh, when you see the first tooth, that is your at least at 6 months of age. That's when your first tooth erupts, first primary tooth that erupts. Okay, you need to take a soft uh, bristle brush, a round-headed brush, and brush it with a fluoride toothpaste. Okay,
Perfect.
yeah. So you can make the
Perfect.
child sit on your front, on your lap, or you and your husband can make him sleep, lie down, and then brush his teeth. You know, his head on near one's lap and the leg on the other one's lap, and then you can brush his teeth then. So that is also another way of brushing a 6-month-old teeth.
Fantastic. Now the next question is from Neeta, which I believe you've answered in the session already. Which I will answer, Neeta. Neeta says, when should I get my kid to the dentist? So, like Sheena was saying, as soon as the kid is 6 months old, you should, correct me if I'm wrong, Sheena. Right? Correct?
Yeah,
As
it's
soon as,
correct.
that's correct, right?
That's
All right. So as soon as the kid is 6 months old, please take the child to the dentist
yeah.
and please get your child's oral hygiene checked. Let's look at, yes, for the first time, that is Sheena. Now, Mommy Knows Everything asks, finger brush to be used from what age?
As I discussed, you can use it at 6 months age of your child, finger brushing. Okay,
But
but
she said finger brush to be
yes,
specific.
yes,
Okay,
finger brushing.
okay,
You
perfect,
can use
perfect,
it at
perfect.
any age. but try to limit more than, I think, 1.5, 2 years. Don't go beyond with your finger brushing. Make your child use your brush after that, and I usually recommend a normal toothbrush rather than a finger brush. Okay,
Okay.
because uh, yeah, it is better to hold and to grip. But a lot of parents feel finger brushing is better than a normal toothbrush. So whichever you think you're comfortable with. But yeah, definitely at 6 months of age or the first tooth that erupts, you should start brushing your child's teeth. Finger brush do not extend more than 1.5 till your child can hold a brush. Stop finger brushing that time and ask your child and or you brush its teeth after that.
All right, perfect. The next question is from Pradnya. Pradnya asks, are we supposed to recommend the silicone finger brush for the babies available in the market?
Um, Silicone finger brushes, they are little, you can say thick, I would say, so using a soft bristle brush is way better than a silicone toothbrush.
Silicone.
So switch on to a soft bristle brush than a silicone toothbrush.
Perfect, perfect. Uh, Now, Mommy Knows Everything asks, which brand's finger brush shall we start with for babies? So she's asking if you have a brand in particular that you'd like to recommend to everyone.
Oh, I personally don't recommend finger brushes. So I
Okay.
would recommend that you buy any brand finger brush, but with a soft bristle. It is very important
Soft
to have a
bristles.
soft bristle, yes, brush for your child. Any brand will do, whichever you, and with a short head. Don't buy the long ones that are available. Like they have a really long bristle head. Buy a short bristle head, which is very good for your child. So any that you find easy, comfortable, and cheap, you can go on. But make sure it is soft tissue.
Perfect. Let's continue. Let's see if we have any other questions. All right.
So
Mommy Knows Everything asks whether teether should be used or not.
yes, teethers are good for your child. Okay, now there are natural teethers which we recommend. Okay, that is your cold carrot cucumber which is available at home. Just freeze it, and if your child is teething, you can give them to chew on that. Or you can take grapes and just wrap it in your handkerchief and you can freeze it and you can just give your child to chew on that. And the teethers which are available in the market, they're also good. But make sure when your child is teething that you can even use your muslin cloth, like take a muslin cloth and keep rubbing your child's gum. That is also helpful. Okay, it's very important because during teething the child salivates a lot. Okay, so make sure that you wipe the child's mouth frequently after after the child is teething or he's using a teether. And also, yeah, I would like to mention now that she said something on teething, that a lot of parents believe that when my child is teething, he has diarrhea and fever and rashes on the face. Now, that is not because of teething, that is because of the teether. So, what happens is when the child is teething, they have a teether toy or anything in their mouth, they tend to remove it and they just throw it away somewhere. And you pick it up
Correct.
and you give it back to the child. Now, we forget that there are a lot of germs around here, okay, at home. So, it's very important that you clean the teether and give it to use again to your child. And that is the reason of diarrhea and fever to your child and not the teething of your teeth. Okay, the rashes that develop on the face is because of the saliva that keeps drooling out. So it's very important that you keep wiping your child's face or mouth with a good cloth or a fresh cloth to avoid that.
How insightful, Sheena. How insightful again. Now, Neha Khajuria asks, my nephew's root canal filling has chipped off a little. Can you tell me what care should we take going forward?
Oh, hi Neha. I would like to tell you that if the tooth has chipped off, try. It's better you visit a dentist first. If you're unable to visit a dentist, um, you should avoid giving him hard food to chew on that side, because there are chances that after a root canal tooth, the tooth might just keep breaking or chipping off. If it's possible, visit a dentist, and I would advise that you get a cap done for your child on that tooth, which will help to prolong the life of the tooth also and help him to eat better. So that is something I would like, if you can visit your dentist or just avoid hard food for right now. Hard and sweet especially.
Perfect. All right. Let's see if we have anything else. Anybody else asking anything? Any other questions, friends? Any other questions? Parents, children, anybody else? Any other question for Dr. Sheena? Nia Kajuri is thanking you, Sheena. She says, thank you so much. All right, then. All right. Now, coming to the question that we've been waiting to ask you is, Dr. Sheena, what do you think about Kids OK, Please?
Oh, I think it's a great platform. I was just going through it the other day, and you have this amazing thing that you're doing, inviting people, helping parents and other people, understand what kids need and uh, everything. It was amazing. I mean, I think you have a session that is coming up with 2 or 3 people right now soon.
Yes, that's Coffee and Childhoods.
Yes,
That
yes.
happened at three in the afternoon. Yes.
Yeah, yeah. So I saw a glimpse of that session, and it was amazing.
Lovely.
It's amazing
Lovely.
how you, yeah, get people
Yes,
along.
so if I could tell you a bit about all of you parents and children, is that we are an initiative that is dedicated towards creating marvelous childhoods. In simpler terms, we are dedicated towards converting our cities to be more child-centered and child-focused, so that every child, or whoever wants, can have access to marvelous childhoods, and marvelous childhoods become commonplace everywhere. So that is the purpose and initiative that is Kids OK, Please. Sheena, it's been such a pleasure to have you with us. What a
It's a
pleasure
pleasure.
indeed, and
Thank
what
you.
a lovely session we've had together. We hope to have you join us soon again.
Yes, definitely. It was an amazing session, and I'm so glad to be a part of this Kids OK session.
Likewise.
I'm looking forward
Likewise.
to many more. Thank you so much for having me.
It's a pleasure, Sheila. It's a pleasure. You take care.
Take care. Bye. See you.
Bye. See you soon. So that was Dr. Sheena Soni in a candid interaction with us, talking about children's oral health, and some wonderful questions asked, and what lovely answers given. Everyone's benefited from this, and we hope to create way many more marvelous childhoods as we move forward. I would again like to thank my colleague Ritesh for having filled in for me while I was away looking at other duties, but I'm back with all of you. And I am very thankful for all your patience, and I am back with Poets and Nights again. I'm back with Kids OK Please again, and all the brands with us. Such a pleasure to be back, to be connecting with you, lovely parents and children. And I shall take your leave now, and I hope to join you soon again. Until then, au revoir. See you soon. Ciao.